There are a lot of different things that cause hip pain. And if you sit down and make a list, you can basically come up with just about everything. There are main common ones, and then there's kind of zebras and a little bit of crazy ones. We'll try to hit the most common ones. We're going to start with the intra-articular, the groin pain, the hip arthritis, the most common ones in that area. By and large, the most common arthritis is the most common cause of pain that's intra-articular or in the groin region. Following by this big long word that means basically your ball and socket are hitting together funny. That's femoral acetabular impingement. The last is labral tears, and then avascular necrosis, which is a condition where the bone is kind of unhealthy, if you will. Hip arthritis is inflammation of the joint. We normally have these smooth gliding cartilage on these two surfaces in the ball and socket of our hip, and over time they can wear, they can break down, they can cause inflammation, pain, bleeding, and all sorts of issues inside the joint. It tends to be progressive. There's a lot of times that it's just wear and tear more than anything else, but sometimes it can run in families, either from rheumatoid arthritis or something else. Hip arthritis, when you're taking a look at a picture. So when we're looking at the hip joint, again, it's a ball and a socket. The socket itself is like a big half of a sphere, and then the ball itself is just like that. It's almost a perfect sphere. Over time, you can get wear and tear in those areas where that smooth cartilage is, and that shows that bone underneath it. The cartilage wears off, it causes leaking of that marrow elements, which in turn causes inflammation. If you look on the left side, you can see normal joint space. When you're looking at a ball in a socket, you should be able to see a whole bunch of space between the end of the socket and the top of the ball, and that's where the joint lives, where the cartilage lives. Over time, that space will kind of pinch down and get smaller and smaller, and you can kind of lose the space almost altogether. The way the body tries to accommodate that is by making bone spurs and making more space. It ends up making more bone to accommodate the increased force that it's seeing. If you take a picture of someone at different points in time, you'll see that almost 100% of the time hip arthritis is progressive. It gets worse. You have a little bit over here, and we're looking primarily at the area between the end of the ball and the top of the socket there. You can see it slowly kind of dissipate until almost nothing, just within a few years' time. The typical symptoms are kind of stiffness, soreness, pain with getting up and getting from a seated to standing position. Pain that usually kind of works its way out once you get going, but it tends to happen every time you either stop or start motion. Usually is worse in the morning, and it keeps you from moving that full range of motion like you like. You can have a lot of different reasons to have it. It's more common in women. It's more common with people who have a family history in it. It can happen because of trauma, because you injured yourself or had a break or tear. It can just happen. It runs in the family pretty heavily. There are all sorts of other deformities of the hip that are much less common, like hip dysplasia and slip capital femoral epiphysis and this disease where the bone doesn't heal or grow like it's supposed to when you're a kid, and that can all predispose you to developing wear and tear in your joint as you age. The primary treatments are always the same for most orthopedic issues, which are anti-inflammatory medications, weight loss. We use a medicine called cortisone, which is a strong anti-inflammatory, and we can put that in the joint itself to help with pain. Therapy helps loosen up stiff joints, and then ultimately surgical options exist. The primary surgery that's done for arthritis is a replacement. We don't have a way to make the cartilage grow back to where it was before. We don't have a way to make the deformity that's caused by the wear and tear over time to go back to where it was before. We do have a way to replace it. You end up taking that damaged ball, making a smooth ball. You take out that damaged cup and you make a smooth cup. These are the components of a hip replacement. You have a piece of metal called a stem that's attached to a smooth metal ball that goes right down deep into your femur bone itself. At the cup level, or over here, you have a big cup that's resurfaced or implanted into that cup, and in between there is a very smooth piece of plastic that can last years and years and years. Typically, they last somewhere between 15 to 20 years, depending on kind of lifestyle and activity level. This is kind of a before and after shot. If you take a look at the hips on the right side, the left one is the affected one. You know, we always take pictures looking front to back, so you're looking at someone looking at you. This is their left hip, and when you replace it, all those metal parts that we showed you end up on that x-ray. It's how it would look if you took a picture afterwards. The second kind of hip pain, femoral acetabular impingement, is kind of on the same spectrum as what causes arthritis. This is where you have an imperfect cup, where you have an imperfect ball, and over time those two wear into each other. They can also be associated with labral tears, which is a tissue we'll show you in a little bit. A perfect cup and a perfect ball fit together really well and really have no reason to cause damage over time. The cartilage is great, lasts long, it's much smoother than ice on ice, but something can happen. And sometimes what happens is we're just a tiny bit off of perfect specification. We have maybe a little bit extra bone around the cup. We maybe have a little extra bone around the top of the ball. Maybe we have a little bit of both. And as you can imagine, as we do that motion over time, it might just be a little bit, but eventually it can just wear. This is what a cup would look like. Your own pelvis, cup, socket, whatever you want to call it, if you're looking straight at it from the top to bottom there. The ball of the head of the femur bone is right over here, and then the cup itself has this soft tissue down in the base. The cartilage only covers a portion of that joint, and then we have this big tissue that wraps around that acts like a fluid holder, or a suction cup. It helps the hip act like it's supposed to, and that's called the labrum. The labrum itself is very important to the normal function of the hip. It keeps the fluid in the joint, it keeps the suction on the hip, and it keeps things lubricated like they need to be. It can be torn, and a lot of times it can be torn because of that imperfect socket or that imperfect ball. And tears, when we're looking at an MRI, we're looking at that lip, that little edge of the tissue that I showed you previously. It should be a nice perfect triangle, black, without all that fluid all the way around it. And here in the case, you can see it kind of ripped or rent in there. What that does is let the fluid out. The suction doesn't work as well on the hip. You get more motion in the hip. More motion that's not supposed to be there will eventually kind of grind and wear. It can be in anyone. It happens more commonly in women, like a lot of hip conditions. It's highest when you have dysplasia. Dysplasia is that term saying your ball is funny. And that's the way you're grown up, and that's the way you were born, and it's been there since you were born. Treatment for labral tears, again, pretty much the same stuff. Anti-inflammatories, cortisone shots, physical therapy, surgery. The surgery for just the labral tear alone, they can be successful in very young patients. As you age, they become less and less successful. One of the ways to trying to fix that is with a hip scope. You may have heard of people having knee scopes where they put some poke holes in there and use little tools to fix or remove that damaged tissue and try to get it to heal. That can be done on hips too. It's generally more successful in younger patients around 30-ish. As you get older, it becomes less successful. And if it gets to the point where you need something like that in an older, say older than 65, most of the time people end up getting hip replacements by the end of the year anyway. Pretty complex how you get in there. The hip socket is very deep. When you're just looking at it, you feel like you could probably touch or feel down low, but usually it's at least about 6 inches down deep to get to the joint. Those cameras that they use for the knee scope are modified to be able to get all the way down there to try to get into the joint to try to fix or debride that damaged tissue. The last one we'll talk about that's more the intra-articular or the groin pain type of pain is what we call avascular necrosis. It also goes by osteonecrosis. And what it really means is bone death. And by bone death, it can happen for all sorts of different reasons. But it's usually an accelerated form of arthritis caused by the fact that the blood supply to the top of the ball for the ball and socket somehow gets interrupted. It can be due to many reasons. Sometimes it's genetics. Most of the time it's medications. And then secondarily might be trauma. These two things right here, the steroids, like chronic steroids if you have a lung condition, or alcoholism account for more than 50% of that avascular necrosis that we call idiopathic. The other causes, or trauma, is really the most common cause of developing that osteonecrosis. The blood supply to the ball is very tenuous. It's tiny little blood vessels, and there's really one little small branch that's in charge of the majority of the ball and socket blood flow. And if that gets interrupted for whatever reason, you can lose that bone structure. You'll get resorption. If you look at the end, starting with the top left and kind of working your way down left to right, you'll see something show up where those arrows are. If you kind of focus in on this area, there's a decreased density. The ball still kind of looks like it's supposed to, but over time, you can see that density kind of decrease. And you can start to see changes in the top of the ball. We need blood flow to both break down bone and build up bone. If you have a sudden interruption of the blood supply, we stop remodeling our bone. And what happens is it actually becomes denser at first because there's nothing breaking it down. But eventually that chalky bone that's really not broken down well will start to squish together. And that will cause your ball to change shape, which will cause, a square peg in a round hole and eventually kind of grind and wear. That's one of the other causes of accelerated arthritis. Treatments are all the same. Most folks who end up in the avascular necrosis area tend to go on to surgery, and it's usually a hip replacement.